Hello, everyone. Thank you so much for joining us today. I'm delighted to welcome you to today's Science Talk. My name is Dr. Miriam Axel, and I'm thrilled to be your host today. For those of you who are joining us for the first time, we welcome you and would like to let you know that all of our science talks are available on our website and on our YouTube channel. On our website at unu.edu/INWEH/science-talks with an S. Today's talk, like all others, will be recorded, and the video will be made available after the session, both on our website and on our YouTube channel. I'd also like to remind you that we will conclude with an interactive question and answer session, so please do use the Q&A box to put your questions in at any point during the talk, and I will be sure to read them to today's speaker. Today's talk is titled Antimicrobial Resistant Bacteria in Water Supplies at Healthcare Facilities, Evidence from Gaza, Palestine. Our speaker is Dr. Reem Abu Shomar, who is a research fellow in water and public health in conflict zones, and she focuses on the intersection of water, health, and the environment, emphasizing sustainable, rights-based, and evidence-driven interventions for communities impacted by conflict. Dr. Abu Shomar has extensive experience working with both national and international organizations in Gaza, Palestine. Her expertise spans multidisciplinary research on water quality, public health, and gender-responsive strategies in humanitarian contexts. She's also led multi-stakeholder initiatives and programs aimed at strengthening WASH and public health resilience through capacity building activities, policy advice, and baseline studies. Dr. Abu Shomar holds a PhD in water technology and a Master of Public Health. Now, it is my great honor to turn it over to our speaker today. Dr. Abu Shomar, over to you.
Well, thank you, dear Mariam. Greetings, everyone. First of all, I would like to thank you, Dr. Mariam, for this kind introduction, and thanks to UNWEH for the opportunity to present this scientific talk. As we all know, water is essential for life and well-being. However, in conflict zones and war zones, when the water and health infrastructures are already fragile, contaminated water can be a dangerous, silent threat that can affect the lives of people there. Imagine that you are admitted to a healthcare facility and the water used for hand washing, for cleaning wounds, for dental care, carrying something that more dangerous than the disease you came with. Today, I will present or share some findings from my PhD study on antimicrobial resistant bacteria in water supplies at healthcare facilities in Gaza, Palestine, the region facing the most complex humanitarian, political, and water crisis in the world. Under the supervision of Professor El-Manama and Professor Zaytoun, the study highlighted the risks and implications of antimicrobial resistant bacteria in water supply, highlighting also the urgent need for sustainable solutions. Moving to the next slide. Can you see it, Miriam? Because it's...
No, you're still on the first slide.
Okay. So I'll share it again because it's not moving even at my side. Okay. Is it okay now? Can you see the second slide, the outline?
We still see the first slide.
Okay. Now, is it okay?
Yes.
Okay. So before navigating into details, I will start by an introduction and an overview of the current situation, sharing or detailing why this issue matters. And then I will present the main objectives, the significance, the used methodology, and the main results. Finally, I will conclude with recommendations that help to mitigate the existing growing challenge. Okay. To emphasize the critical link between water and health, I would like to start or to quote those powerful statements by WHO. The first one by Dr. Lee, the former Director General of WHO, who said that water and sanitation is one of the primary drivers of public health, and he often refers to it as Health 101, which means that once we can secure access to safe water and sanitation for all, a huge battle against all kinds of disease will be won. Similarly, Dr. Tedros, the current director of WHO, said that the widespread lack of wash services in healthcare facilities not only compromises patient safety, but also can increase the risk of antimicrobial infections. And to further emphasize the importance of water as a human right rather than a privilege, Kofi Annan, the former United Nations Secretary General, said that access to safe water is a fundamental human need and therefore a basic human right. And the right to water was explained in the General Comment number 15, 2002, to entitle everyone to sufficient, safe, acceptable, physically accessible, and affordable amounts for personal and domestic use. And here, the integrated water and health based approach links key sustainable goals together, mainly the sustainable goal number 3, which about good health and well-being, and the sustainable goal number 6, which related to clean water and sanitation. Of course, while mainstreaming SDG 5, the gender equality goal, and the SDG 10 related to reduced inequalities. This approach acknowledges that water and health, in addition to equity, are interconnected, and that sustainable development cannot be achieved in isolation. And by addressing those SDGs, we create a more holistic framework to improve access to safe water in addition to public health, and while leaving no one behind, particularly the vulnerable groups. And here, let me explain the traditional epidemiology triad model that explain the interrelation between health and water. This approach or this model suggests that infectious disease results from interaction between 3 key factors: the agent, the host, and the environment. And it's essential for us to understand the waterborne diseases, including the ones caused by the antimicrobial resistance, to understand this approach. In this context, waterborne diseases can be caused by an agent like antimicrobial resistant bacteria that interact with susceptible hosts that can be immunocompromised child, And this can happen in an environment like healthcare facility lacking water, safe water and sanitation services. And therefore, this will help in the spread of this microbe and the transmission of diseases. So why WASH, the water sanitation and hygiene in healthcare facilities, is a global concern? It's shocking to know that 25% of healthcare facilities lack basic water services. And hand hygiene materials are missing in around 60% of 16% of the healthcare facilities. And more concerning that 60% of water storage reservoirs have moderate or high risk of contamination. And why antimicrobial resistance, in addition to WASH in healthcare facilities, are global concerns. Actually, what the AMR occurs when a microorganism develops the ability to survive exposure to antimicrobial agents that were once effective against them. And according to WHO, AMR is one of the top 10 global challenges affecting humanity. And if there's no action, it's projected that it will cause more than 10 million deaths by 2050. In addition to that, healthcare environment play a room or a home for AMR pathogens to live and to be transmitted within this facility or outside the facility. And according to WHO also, the spread of antimicrobial resistant bacteria is known to be influenced by several factors, including the access to safe water and sanitation, in addition to infection control practices and proper diagnosis and treatment of cases. And it is believed that the investment in water sanitation and hygiene will contribute to the reduction of healthcare acquired infections and will also reduce antimicrobial resistance and will improve the occupational health and safety of patients, of health workers, also for the patients. It will improve the safety of the patients who seek help at those facilities. And this slide highlights the consequences of poor water sanitation and hygiene services at healthcare facilities in parallel with the compromised infection prevention and control practices. At the end, both the poor WASH services and the compromised IPC practices will contribute to the increase in the spread of antimicrobial resistance. Now let us take a closer look to the Gaza Strip, Palestine, which is the focus area of this study. Gaza, as part of the occupied Palestinian territories, covering 365 square kilometers and stretching 41 kilometers along the Mediterranean Sea, with varied and varies between 6 to 12 kilometers in width. Administratively, it is divided into 5 districts: the north, Gaza, middle, Khan Younis, and Rafah, with the estimated population of 2.1 million and the annual growth of 3.2%. The area is considered as one of the most densely populated area in the world, with approximately 5,500 persons per square kilometer. Actually, this This figure after the 7th of October have increased by 3 to 6 times in some areas. And the access to safe water is a major challenge in Gaza, according to PWA reports, Palestinian Water Authority reports in 2021. The average water consumption reached around 89 liters per capita per day, which below the WHO recommended values. And during the war, the recent war, the daily consumption dropped to just few liters per capita per day. The coastal aquifer is the only natural water source for Gaza. However, it's being over-extracted at 3 times its sustainable yield, causing seawater intrusion and higher salinity. In addition to that, more than 86% of the groundwater contaminated with nitrates. And when considering both the salinity and nitrate contamination, only 4% of the groundwater considered fit for human use. And the 4% is highlighted as a green color on the maps shown here for the chloride and for the nitrates. And by visualizing those maps for urban areas, the urban areas here in the red color, and this is the nitrate maps, and this is for the wastewater system in Gaza, we can see that the elevated nitrate levels are primarily found in residential zones, indicating the percolation of wastewater from sewage system into the groundwater. And here in this slide, you can see that as a response to the previous challenge, water security challenges in Gaza, the Palestinian authorities in support from the international donors try to adopt strategies for additional non-conventional water resources, such as seawater desalination. And just prior the 7th of October, the public and private desalination plant accounted for 4% of the water supply. This is in parallel with the purchased water. Other options for non-conventional water resources was the treated wastewater for agricultural use, which was under piloting stage. This slide features key infrastructure projects in Gaza that aim to respond to the water insecurities. The first one on the top is the middle area seawater desalination plant with a capacity of 6,000 cubic meter per day. And this facility helped to provide safe water for residents in the middle area and the south area prior and during the war. However, its operation have been much affected by the lack of fuel and energy supplies. The second photo related to the wastewater treatment plant in parallel with the recovery and use scheme. This facility not only helped to protect the aquifer from being contaminated, but also contributed to food insecurity through the water energy food nexus. And here you can see those overlay maps, which was part of the GIS baseline study on water quality and public health in Gaza. It was conducted in 2015. And the results revealed a strong association between the high nitrate levels and the prevalence of parasitic infections in specific years, and also highlighted the association between nitrate level and the hepatitis A infection in 2012. Now moving to the our study about the antimicrobial resistant bacteria and water supply at healthcare facilities. And the main objective was to explore the presence of antimicrobial resistant bacteria in samples collected from healthcare facility-based reverse osmosis desalination and municipal water supplies at healthcare settings in the Gaza Strip. In parallel, the study also assessed the knowledge and perception of healthcare workers related to AMR, antimicrobial resistance, and the water safety. The specific objectives included to assess and compare the prevalence of antimicrobial resistant bacteria in water supply chains provided through reverse osmosis desalination and municipal networks at healthcare settings. The second objective, to assess the prevalence of antimicrobial resistance in surface swabs collected from hand washing facilities at the same facilities. To explore association between chlorination level and bacterial contamination, and to assess the level of, in parallel of that, assess the level of knowledge and perception among workers on AMR and WASH related issues. And finally, to identify the gaps in water safety monitoring with regard to resistant bacteria at healthcare facilities. The significance of this research is highlighted by the existing challenges faced by the water and health systems in Gaza. Actually, antimicrobial resistant bacteria have been already isolated from clinical samples at the healthcare facilities. It was also isolated from wastewater and also isolated from the seawater. However, AMR wasn't investigated prior to this study in water supplies. In addition to that, the increased reliance on desalinated water by reverse osmosis technology in healthcare facilities and the potential of biofilm formation that can hide the AMR bacteria requires more attention, which have been covered by this research. And finally, the good knowledge about water safety and AMR infection among healthcare workers support any efforts that apply the One Health approach in ensuring the water safety in healthcare facilities. And the One Health approach tackle the links between health, human health, and animal and the environment. And we always need to keep in mind that patients seek health care for healing and not for a new risk or additional threat. And moving to the methodology, the study was a cross-sectional study to detect and identify the antimicrobial resistant bacteria in 64 water supply samples collected from reverse osmosis, desalinated water chain supply, and municipal water chain supplies. In addition to 73 surface swabs collected from hand washing facilities. In addition to that, the knowledge and perception was assessed among 322 healthcare workers The assessment covered water safety and AMR related issues through self-administered questionnaire. And thirdly, semi-structured interviews had been conducted with decision makers to identify the gaps in water safety and infection control programs at healthcare facilities. The study was conducted in governmental-run healthcare facilities in Gaza. Water and swab sampling, the field sampling were collected from 5 primary healthcare centers at level 4 centers. And the knowledge and perception survey was expanded to reach 16 primary healthcare centers. Ethical approval was obtained from Helsinki Ethical Approval Committee in Gaza. Also permits were obtained from the Ministry of Health to the field study to collect the water samples from the facilities, and confidentiality was ensured, and the informed consent was obtained prior the distribution of the questionnaire. 64 water samples was collected with 73 swabs and transported to laboratory based on standard laboratory procedures. On the field, free residual chlorine and pH levels were assessed using standard method DBT for free residual chlorine and phenol red for the pH level. And in the laboratory, the presence and identification, in addition to the antimicrobial susceptibility testing, were performed using standard membrane filtration techniques, selective media for coliform, for Pseudomonas, in addition to the Staph aureus. So the used media was amendo for coliform, citramide for Pseudomonas, and MSA for Staph aureus. And finally, the susceptibility test was conducted. And after that, the molecular biology testing using the PCR technique was used to detect the AMR genes, including SBL genes and the MEC genes. At the last stage, the data were entered, analyzed, and interpreted using SPSS software. And here, this initial analysis, this table shows the initial analysis of compliance with the Palestinian standards for drinking water. As you can see, only 6% of the samples were compliant with free residual chlorine, indicating low level of chlorination or high consumption of chlorine by bacteria. In addition to that, more than half of the samples were contaminated with coliforms. And the pH level also, it was compliant, but further analysis shows that it was acidic for the desalination plants compared to the more acidic compared to the municipal water supplies. And when we expanded the study to include other than coliforms, to include Pseudomonas and Staph aureus, the level of contamination increased and reached 75% of the sample, which is a very serious issue. The 75% of the samples that was contaminated either by coliforms, Pseudomonas, or Staph aureus, 33% in desalinated water supplies, and 42% in the municipal water supplies. And compared to the high levels of bacterial contamination in water samples, we can see less contamination levels in the swab samples collected from the hand washing facilities. And this difference was statistically significant, highlighting the risk posed by the contaminated water in healthcare facilities in Gaza. And here, when we compare the level of contamination between desalinated and municipal water supplies, we find that both of them have higher contamination levels, with a slighter higher contamination levels in the municipal water supplies. However, this difference was statistically insignificant, suggesting that both water sources have the same risk level of microbial contamination, whatever the treatment process. Moving to this table, this table presents the antimicrobial resistant profile for coliform by sample type, whether it's water or swab sample, and the water samples including the desalination or municipal water supplies. And you can see here the name of antibiotics used to test for coliform. And the good thing is that almost all the coliform, the isolated coliform, were sensitive to broad range of antibiotics such as amikacin, chloramphenicol, ciprofloxacin, gentamicin, and in addition to piperacillin, tazobactam. However, there were notable resistance to imipenem, this one, and the results showed that around 91% of the isolates were resistant to imipenem, which is a concerning finding, as imipenem is considered or used as a last line treatment for multi-drug resistant infections. This slide shows the antimicrobial resistant profile for another bacteria, which is Pseudomonas, and also the results was disaggregated by sample type, whether water or swabs, and the water covered the desalinated and municipal water supplies. The finding shows high level of resistance with regard to specific antibiotics that reach around 85% of the isolate, which was resistant to imipenem and piperacillin, as you can see here. The high levels were also detected. The resistant Pseudomonas was detected in both desalinated and municipal water supplies, highlighting the spread of resistant Pseudomonas regardless of the water treatment method. And this slide also presents the antimicrobial resistant profile for Staph aureus by sample type, by swab and water supplies. And as you can see, around 29% of the isolates showed resistance to tetracycline, while 24% were resistant to penicillin. And further analysis revealed that resistant strains of Staph aureus were also detected in both desalinated and municipal water supplies. As an indicator of high-risk contamination source, multiple antibiotic resistant index was calculated, and the results in this table shows that Pseudomonas had the highest MAR index at 0.4, followed by coliform with a threshold level of MAR index 0.02, 0.2, I'm sorry. And the lowest index was related to the Staph aureus at level of 0.1. And as I mentioned earlier, MAR index is an indicator of the high risk contamination source. And this slide showed the antimicrobial resistance genes detected in water supplies within the coliform and Pseudomonas and Staph aureus isolates. The first 6 genes are considered among the ESBL genes, extended spectrum beta-lactamase genes. And as you can see that the ESBL genes were detected in the isolates of coliforms. In addition to that, and more concerning, the carbapenem-resistant gene, the NDM gene, which was found in around 26% of the Pseudomonas isolates. And moreover, the methicillin-resistant gene, the MEK gene, which was detected in around 14% of the Staph aureus isolates, indicating the presence of MRSA, the methicillin-resistant Staph aureus strains. And now I'll be moving to the second part of the study, which about the assessment of knowledge and perception of healthcare workers through the self-administered questionnaires. And here you can see in this table the summarize the characteristics of study population. As you can see, more than around half of the participants were female staff, and their age ranged from 19 to 60 years old. And around 64% of the health workers have bachelor degree, around 13% have postgraduate studies, and less than 7% have high school or less. Around 70% of the study population were medical staff. The other 30%, they were either engineers, they were admin staff, and they were categorized under the non-medical category. And 28% were holding the managerial positions. And only 28%, around 29% have attended WASH training, compared to 8% who have attended training on, I think that only 29% of that healthcare workers attended training related to WASH, while 8% attended trainings on AMR. This slide showed the lack of awareness and knowledge among healthcare workers. As you can see here, around 53% of the healthcare workers were unfamiliar with the WASH terminology, that stands for water, sanitation, and hygiene, and that around 23% of them were unable to define antimicrobial resistance in a correct way, and that 37% of them they didn't know that healthy individuals can carry and transmit antimicrobial resistance. And applying the gender lens, females showed higher levels of knowledge with regard to the WASH term than males, and the difference was statistically significant with p-value that reached 0.001. Another important gap in knowledge highlighted in this slide, 59% of the study population were unfamiliar with existing national drinking water standards, and 18% did not know that residual chlorine or free residual chlorine is one of the indicators for water safety. And and the gap in knowledge was more, I think here, via applying the gender lens, we can see that both genders have low level of knowledge, and with a slight lower levels among males. However, this difference was statistically insignificant. And this table shows the results when it comes to perceptions of health workers shown by gender. And the results were disaggregated, as I said in the following slide, also by occupation, and this by gender. In general, the perception of water safety was higher for domestic compared to the drinking water. And when the data was disaggregated, we found that the perception level were lower among females compared to the males, and the difference was statistically significant. And this table shows the perception of healthcare workers by occupation, whether medical or non-medical. And you can see that there is a statistically significant difference when it comes to the gaps in or trust for drinking water safety. So according to the results, there were statistically lower levels of perceptions among medical staff than non-medical staff. Also, around 41% of the respondents had perceptions that regular water safety monitoring occurs at their facility, and around 30% declared that water pollution was reported in their facilities. Around 20% of healthcare workers think that they play a role in monitoring water safety, and around 25% think that they play a role in preventing antimicrobial resistance and contamination. And this slide highlights the findings from the semi-structured interviews, focusing on the gaps related to WASH and AMR and infection prevention control. The gaps were divided into two main categories, the knowledge gaps and the action gaps. Under the knowledge gap, several issues were raised, including the lack of integrated surveillance system, lack of standardized national reporting system, and the lack of GIS-linked database. At action level, and from governance perspective, aligning the national WASH and AMR policies with the global goals was a gap that need to be addressed. And there was a real need for a behavioral-based training programs on AMR and WASH and IPC, infection prevention control, to help the staff not only to gain knowledge, but to apply their gained knowledge effectively in their daily work. And to conclude, the study highlighted high levels of bacterial contamination with alerting antimicrobial resistance profile in both desalinated water and municipal water supplies. There was low chlorination levels in both desalinated and municipal water supplies. And the level of chlorination was very low, particularly within the desalinated water supply. There was also lower pH values in desalinated water compared to the municipal water supply. Pseudomonas bacteria was found to be the main bacterial contaminant in desalinated and municipal water supplies. And the genotyping results revealed the presence of antimicrobial resistance genes, including the extended spectrum beta-lactamase genes that were detected in coliform isolates, in addition to the NDN gene, the carbapenem resistant gene that was detected in Pseudomonas isolates, and the MEK gene that was detected in Staph aureus, in addition to the VAN A, VAN B genes. The study also showed at human resource level a considerable gap in healthcare workers' awareness and perception of water safety in relation to antimicrobial resistance. It shows the low awareness about the role that they can play in ensuring the safety of water supplies and prevention of antimicrobial resistance. It also, the results also showed lack of workers' knowledge about the availability of national drinking water quality standards that include free residual chlorine as an indicator of water safety. The study recommendations included the need to improve water management practices in healthcare facilities, to reduce the risks of antimicrobial resistant infections within those facilities. The recommendation included several interventions or proposed several interventions, including the implementation of regular monitoring programs for water safety and ensuring proper water disinfection process. In addition to that, the sustaining preventive maintenance and continuous rehabilitation of water facilities. The rehabilitation need to include the laboratory testing through equipping those laboratories with suitable equipment for proper testing of water safety. Also recommended the standardization and enforcement of regulations and the implementation of infectious control and reduction of the spread of antimicrobial resistance in the environment. In other words, conventional antimicrobial stewardship programs need to be considered in parallel with the WASH stewardship, particularly at healthcare facilities. And the safety of WASH services needs to be incorporated into the national antimicrobial resistance policies and plans. Also recommended water sanitation and hygiene in addition to antimicrobial resistant hybrid and educational and awareness programs that need to be implemented within the context of water and health nexus approach and the One Health approach that link human and environment together. The investment in water sanitation and hygiene infrastructure at healthcare facilities require parallel investment in capacity building and raising awareness of workers. And at the end, it was highlighted the need to have a combined WASH and AMR surveillance system to enhance the safety of provided services and improve the satisfaction of healthcare workers. And thanks for your active listening. I think I will be back to Miriam for the Q&A session.
Thank you so much, Dr. Abu Shomar, for a really, really wonderful presentation. I think your work highlights a really rare and very important window into this intersection of water quality, healthcare infrastructure, antimicrobial resistance, particularly in one of the most water-stressed and, as you mentioned, densely populated areas in the world. And I think I'm really impressed by both the level of the scientific rigor of your approach, looking at bacterial isolates and gene detection, and then also how you framed everything within this, within the broader context of a rights-based and one health perspectives. And I think you've really convincingly shown that this presence of AMR bacteria in healthcare supplies isn't just a clinical concern, but it's really a systemic and environmental one, and something that impacts patients and healthcare workers both in really profound ways. And I think also your research highlighting that how water systems within healthcare facilities, as you said, patients go to the hospital to be treated, not to pick up new problems. And I think the fact that especially those that are relying on desalinated sources, how they can become these silent carriers of resistant genes that amplifies these health risks, particularly in places where infrastructure is already fragile. So thank you so much for a really excellent presentation. To start off, I have a couple of questions. First, you mentioned that the desalinated water has a significantly lower pH than municipal water. And I'm wondering if you could talk a little bit about the implications of that finding in terms of microbial vulnerability or potential impacts on infrastructure or patient health.
Okay, thank you. Thank you for this question. Actually, I've mentioned the pH, the low levels in desalinated water. It has an implication on the infrastructure. It can have an implication even in the networks. It can cause damage to the networks. But the most important thing is what the health impact and how can it affect or put more stress even into the existing bacteria, making some of them able to uptake genes under this stress environment from non-resistant genes, from resistant bacteria. I mean, this environment can add stress to the existing bacteria, making it more stressful and able to uptake genes from the surrounding environment. The issue was also the important issue that we need to know why this pH level was lower in the desalinated water than the municipal water. And in my perspective, that within the context with low resources and high vulnerability under conflict areas, there is lack of resources. And I think the process of desalination might have been affected. I mean, The desalination process should be preceded by a pre-treatment process that include adding some acidic solution to prevent scaling and fouling. But I'm expecting within the existing low capacities and low resources, there is no pH adjustment process. The post-treatment process within the desalination technology wasn't done in a proper way. Back to you. I hope that I answered the question.
Yes, thank you. Also turning now to your points about the sort of social implications of this, I think it's really interesting that only a very small percentage of healthcare workers felt that they had a role to play in AMR prevention. From your perspective, what type of training or institutional support or awareness programs do you think are most needed to help close that gap?
In order, thanks again for this question. In order to close this gap, we need to have maybe a further assessment on the capacity building needs. But from the questionnaire that, or the results from the assessment that we have done, we can recommend that we need to have a kind of hybrid educational program that address the water sanitation and hygiene, covering the safety of water and sanitation. In addition to the antimicrobial resistant bacteria, training on the infection prevention and control related to the link between the WASH and antimicrobial resistance. So we need a kind of holistic hybrid training program that covers all aspects of this issue.
Thank you. In terms of that holistic hybrid approach that you're mentioning, I wonder if you could go back a bit to the One Health approach as well. I guess from a broader sense, sort of beyond training, how do you see WASH and AMR surveillance being integrated into national strategies or international strategies, especially in locations of crisis like Gaza?
Actually, prior to the existing current madness and war in Gaza, there was a great offer to introduce or to link both aspects and surveillance systems. The water authorities with the Ministry of Health worked together, and we have established in 2015, it's around 10 years ago, a baseline study, GIS baseline study, that tried to link both surveillance together. However, it wasn't integrated or institutionalized within the existing database within the health and the water authorities. That was a critical issue that and a gap that need to be handled. Within the humanitarian context, I think there should be a kind of real-time surveillance that capture any elevation or any alerts with regard to waterborne diseases or antimicrobial relevant issues that relate to the water and sanitation safety. And besides of that, I think that we need to address the real cause of every conflict. And once we were able to have the sustainable environment, then everything, I think, will it will be served as a stable platform that can report against any antimicrobial resistant and WASH related safety related issues.
Oh, and then one final question. We're almost out of time, but Professor Grace asks if you are aware of any water safety plans or WSP And if yes, was it considered an approach to safeguard the water systems in healthcare facilities as a recommendation?
Actually, the Palestinian Water Authority have started last 5 years to advocate for having water safety plans within the existing water systems. However, those plans were not fully implemented because of the political instabilities and the high vulnerability of the resources and lack of disinfection. The chlorine wasn't always available at the water facilities and the healthcare facilities. So the water safety plans, it was there, but the implementation and the follow-up was really affected by the vulnerable and the fragile situation there.
I think this seems like a topic for a whole nother conversation. I think it sounds like there's really a lot to unpack there, but unfortunately we're out of time. I want to thank you again so much for your really important research. Thank you for taking the time to share with us today. We remind our viewers that this recording and all of our other science talks are available, and this one will be available shortly on our website. Thank you all so much for joining us. Thank you very much, Dr. Abu Shomar. And we look forward to seeing you next week.
Thank you. Thank you, my dear. And thanks to UNU-INWEH. Bye.